All right, today we are diving into a medical technique that honestly sounds almost like a magic trick. How can you figure out the size and the exact position of a person's heart? Well, the answer is kind of amazing, and it all comes down to listening to the sound of a simple tap. I know, right? It sounds a little unbelievable that just tapping on someone's chest could give you a detailed map of one of our most vital organs. So, how on earth does this actually work? Let's get into it. So, here's our game plan. We're going to start with the basics of tapping for clues. Then we'll see how a sound map of the heart is actually built. After that, we'll look at what it means when that map shifts around or gets bigger or smaller. And by the end, you'll see exactly what this incredible map can tell us. Okay, so first things first, where do we even start? Well, it all begins with that simple act of tapping and the surprising amount of information you can get from it. Now, this technique has a name, of course. It's called percussion. And you've probably done something like it yourself. Think about tapping on a wall in your house, right? You're listening for that sound to change from hollow to a solid, dull thud. That's how you find a stud. Well, doctors are doing the exact same thing, just on the chest. Right, so before you can spot any problems, you've got to know what normal sounds like. You have to establish a baseline. So let's look at how we map the sounds of a healthy heart, which is all about listening for two very distinct kinds of sounds.
And here's the crucial difference. When you tap over the part of the heart that's directly against the chest wall, with no lung in the way, you get a clear, dull thud. That's absolute dullness. But where the edges of the air-filled lungs overlap the heart, that sound gets a little muffled. We call that relative dullness. To build our map, we're really listening for the clear borders of that absolute dullness.
So by tapping carefully and just listening for that sound to shift to that solid, absolutely dull sound, a physician can, quite literally trace a virtual map of the heart's borders right onto the chest. It's pretty amazing.
And for a healthy heart, there are some pretty typical landmarks. The right border, you'll find that right next to the breastbone. The left border is a little lower and a bit further out. And that upper border usually sits right around the level of the fourth rib. Those 3 points give us our baseline, the normal shape and location of the heart.
Okay, so that's the baseline. But the really interesting part is what happens when that map starts to look different. When a boundary shifts, it can be a huge clue about what's going on with the heart. So let's see what those changes can tell us. You might think of the heart as being totally locked in place, but it's not. Its position can actually change. It can get pushed or pulled, either by things happening inside its own chambers or by pressure from everything around it. And this is where it gets super interesting. The direction the map shifts tells you a ton. If that dull sound shifts to the right, it's often a sign the right ventricle has gotten bigger, maybe from something like chronic lung disease. And if the map shifts to the left, that usually points to the left ventricle expanding, which can happen with high blood pressure. See, the location of the sound points right to the part of the heart that's under stress. But get this, it's not always the heart's fault. Sometimes outside forces are at play. For instance, if fluid or air builds up in the chest cavity, it can literally push the heart over toward the healthy side. And on the flip side, if a lung shrinks down or scar tissue forms, it can actually pull the heart towards the problem side. All right, so we've talked about the map moving left and right, but what if the map itself gets bigger or smaller? The total size of our sound map can tell a whole different and equally dramatic story.
So when that area of dullness gets bigger, what's going on? Well, a few things could be happening. It could mean the heart's chambers themselves have gotten larger or thicker. Or maybe there's fluid building up in that little sac around the heart. Or it might not even be the heart getting bigger at all, but the lungs getting smaller, pulling back and revealing more of the heart for us to hear.
And then, of course, you've got the opposite situation. A smaller map almost always means something is covering the heart up. Things like emphysema, or even just taking a really deep breath, cause the lungs to inflate and basically throw a blanket over the heart, masking its dull sound. The heart's still there, of course, it's just much harder to hear with a tap. And check this out. Even the position of your diaphragm, that big muscle under your lungs, has a direct physical effect. When the diaphragm sits high, it actually pushes the heart up and makes it lie more horizontally. This makes its sound map seem wider. But when the diaphragm is low, the heart gets to hang more vertically, which creates a much narrower map. So let's pull all this together. After all this tapping and mapping and listening, what's the big picture? What have we really learned? What it really comes down to is this. The body is talking to us all the time. The sounds it makes, those dull thuds, the resonant echoes, they're a language, and a skill like percussion is what allows a doctor to translate that language into a diagnosis. And what's so cool is that this sound map isn't just a picture of the heart by itself. It's a picture of a relationship. It shows this incredibly dynamic dance between the heart, the lungs that surround it, and the diaphragm that supports it all. When one of them changes, it immediately affects the others.
Which, leaves us with a really interesting question for today. In our world of high-tech MRIs and CT scans, what's the value of a technique that just relies on a good pair of ears and some fingers? Well, maybe it's in its simplicity, its accessibility, and maybe it's a reminder that sometimes the most powerful insights come from just listening really closely to what the body has to say.